I'm Amy, and I'm a senior nursing aide caring for residents living with advanced dementia. It is important for us to connect with persons living with dementia, make them feel calm, comfortable, and loved. Most of them find it difficult to express themselves or communicate clearly their wishes and wants at the moderate to advanced stage of dementia. This is where Namaste Care comes in helpful. It allows persons living with moderate to advanced dementia to connect through loving touch and promotes positive and meaningful relationships with their caregivers. In this video, I will show you a step-by-step guide on how to practice Namaste Care. But first, what exactly is it? Namaste Care is a program developed in 2003 by Joy Simard. Namaste means to honor the spirit within. The program adopts a person-centered care approach to support people living with moderate to advanced dementia to meet their sensory and emotional needs and improve their quality of life. It is also suitable for persons with end-stage illnesses such as cancer, who may lack social engagement and stimulation, as well as potentially be experiencing pain and feelings of depression. Person-centered care is a holistic approach to dementia care where every person with dementia is treated with dignity, compassion, and respect. It focuses on using the person's history, routines, personal preference, and needs to support his or her well-being. The purpose of Namaste Care is to give comfort and pleasure through two pillars: a calm environment and an unhurried loving touch. Now, let me show you on how to practice Namaste Care. When it is time to carry out Namaste Care, create a calm environment before the care recipient enters the room. This is the first pillar of the care program. Create a soft lighting by drawing the curtains. Make sure the room is quiet. The room should feel cool and comfortable. A high-back chair with an armrest like this one is ideal. However, we recommend using a lounge chair as it can be reclined to promote comfort and relaxation and aid in posture support. Namaste Care can also be carried out in bed. Play soft, relaxing music that he or she enjoys. You can scent the room with aromatherapy oil. For instance, lavender is known to relieve tension and anxiety. But it is always good to check how the care recipient responds to the scent before putting it on. Now, you are ready to invite the care recipient into the room for touch therapy. You should give a warm greeting.
Good morning, Madam Tan. It's so nice to see you again.
This ensures that the person living with dementia is recognized with respect and affection at the start of each session. Before we begin Namaste Care, observe. How does the care recipient feel today? If the care recipient is overly distressed or agitated, it is best to carry out Namaste Care at another time. Regular sessions of Namaste Care help to promote general well-being and reduce anxiety, agitation, and pain. If she is displaying behaviors of concern such as violence or is averse to touch, I would advise that for safety reasons, it's best to find other ways to engage her senses, such as listening to music. The second pillar of Namaste Care is to provide an unhurried, loving touch in all activities and interactions. Here, we demonstrate Namaste Care in the form of a gentle massage. Some pre-massage measures to note: remove all jewelry, wash or sanitize your hands, keep your nails short. Professional caregivers such as nursing home care staff should wear gloves for health and safety reasons, especially during the COVID-19 pandemic. However, skin-to-skin contact helps us to connect with the individual. If you are delivering Namaste Care to a household member, you may choose to omit gloves. During the massage, avoid areas with skin injuries such as cuts, bruises, or rashes. Be gentle with contractures and nearby joints. Contractures are permanent tightening or stiffness of muscles, tendons, and ligaments.
I will proceed with your massage, Madam Tan. Will it be okay if I hold your hand?
For persons living with dementia who can't express consent, it is still important to respect them by letting them know our next action.
I would like to do a hand massage for you.
If the person living with dementia is sensitive to lotions, creams, or smells, the massage can be carried out without lotion. Remember to ask how she feels throughout the session.
Does you feel comfortable? Are you feeling okay? Thank you, Madam Tan.
You should also be comfortable and relaxed as your energy can be picked up by the care recipient. You can start with a feathery stroke that says, "Hello." Using your fingertips, stroke lightly from the shoulder down the arm until you reach the hand. This initiates your touch conversation. Next, create warmth by rubbing around the big joints. This stimulates energy flow. Support the arm with an arm rest or pillow. Cup the shoulder with your palm and make slow, gentle circles over it. Then, move on to the elbow. With the same hand you used on the shoulder, make slow, deliberate circles around the elbow. Place your other hand anywhere on his or her arm to provide a feeling of connection and support. Next, make circular movements over the top of the wrist. Use your free hand as a support below. Namaste Care improves quality of life by promoting relaxation and may reduce arthritic and rheumatic pain. Make small circular strokes over the knuckles while resting your hand on top. You don't need to apply additional pressure. When the circular strokes are completed, use gliding strokes over the back of the hand with your thumbs. This is a basic stroke to promote relaxation. The back of the hand is not so fleshy, so do not apply additional pressure. Gently rub from the center of the hand out to the sides. Work on the upper half of the hand first. Do a few strokes and move your thumbs to the middle to repeat the gliding strokes on the lower half of the hand. Finish just above the finger web. A massage does more than take away pain. This one-on-one interaction and nonverbal communication can fulfill this need and reduce feelings of isolation.
Next is your palm, Madam Tan. I will turn over your hand and then your palm will face up.
Place both thumbs in the center of the palm and glide outwards towards the sides of the hand. Apply gliding strokes across each section of the palm starting at the top, just below the wrist, and work your way down to the bottom of the palm over the pads that lead to the fingers. Your gestures become more focused as you move towards the fingers. Again, check if the care recipient is comfortable with this massage technique. Some may not be able to turn their palm upwards. In this case, turn the palm down. Supporting the hand, gently stroke each finger from the knuckle to the fingertip. Make a long sweeping stroke towards the tip or make small circles at the sides of the fingers along the way. You may also apply intermittent pressure. It is like walking down the finger. Massage one finger at a time and make sure not to squeeze. Now, we explore the meridian points. The first one lies about 2 inches above the wrist crease. According to traditional Chinese medicine, meridian points are acupressure points where energy flows across. Putting pressure on these points is believed to bring the bodily system back into balance. Next, we move to the center of the palm and the side near the pinky finger, right behind its knuckle. Finally, the bony protrusion at the wrist. You can find it by drawing a line down from between the ring and pinky fingers. Maintain the connection by holding the fingertips. Do it gently one at a time for 1 to 3 minutes. Finally, Indicate the end of Namaste Care by repeating the light feathery strokes from the shoulder down to the fingertips. Touch is powerful and therapeutic. It draws a response from a person living with advanced dementia who may be non-responsive. Before Namaste Care, Madam Tan rarely smiled or talked to her professional caregivers. She was also a picky eater and refused to participate in activities. After introducing Namaste Care, she started to converse with my colleagues and I and participate in activities. Her appetite also improved. The total duration of the massage may vary depending on the care recipient, time of the day, and other environmental factors. In general, 30 minutes is ideal. The aim is for Namaste Care to become a key part of one's daily routine. Whether you are helping with showers or meals, do so in a calm, loving, and unhurried manner. Besides a massage, you can provide other meaningful activities like hair brushing, feeding of favorite food and drinks, wiping the face and hands with a warm washcloth, and moisturizing the face and hands. Consider the person's preferences related to the 5 senses and the food and drinks that he or she likes. This is so we can incorporate them as part of the multisensory environment during each Namaste Care session.
Thank you, Madam Tan.
You will notice the benefits of Namaste Care with time. How quickly it works depends on the care recipient's personality, health, and frequency of sessions. We hope that you have found this guide helpful in providing Namaste Care to persons living with dementia in your care. Thank you.